Hello,
Hello,
Sana.
doctor. Hello.
I'm Dr. Farida, and I just saw that you are 30 years of age. Is that right?
Yes.
Okay, Sana, tell me about your problem, please.
Doctor, I just don't feel very okay these days. I'm having some sort of discomfort.
Okay, tell me more about it, Sana. What is discomfort?
I just feel that I can't catch my breath sometimes. I just feel very out of breath these days.
Okay, and for how long have you been having these symptoms?
Roughly maybe 2 to 3 years, but more so like for 3 to 4 weeks it has increased, I feel.
Okay, right. So, is there any new thing which has happened in the last 2 to 3 weeks? Anything different in your life?
Not really, but I just don't feel really uh, I feel out of my mind sometimes. I can't concentrate on things. I feel I'm going to just collapse when I'm out of breath. I don't know what's happening to me.
And it just happens any time of the day, or is it like on a specific occasion?
I think it happens more when I'm working in my office and when the
Okay.
boss is like over my head and giving me work one by one. That
Okay.
maybe that's why I'm not very sure, but it has increased.
Okay. Do you think that your boss is unreasonably strict, or is it just that you feel it this way?
I think he has been these days. Maybe that's why I just can't take it anymore.
Okay. So, are you able to cope with your daily activities, with your work, or do you take frequent leaves? You don't go to work, you don't feel like working?
Since 2 years, I was able to, I managed somehow, like after sharing with my colleagues and my parents. But now I just can't do that also because I just don't feel like doing it. I just want to quit and I feel frustrated. Yeah,
Mm-hmm. Do you feel low all the time?
kind of, but it's more like I just feel that there's something is going to happen. I just feel my heart pounding. I
Mm-hmm.
don't know what's happening. And those few minutes when this happens, I'm like, I'm just going to die.
Okay. Do you think that you have lost interest in a lot of things which you used to do before? Some,
As
hobbies or
com-
something?
as compared to before, yes, but not as much. I still like to do a few things, but
Okay.
these episodes are very troublesome for me.
Do you cry a lot, even without a reason sometimes?
No, it's just I feel an unease when this happens. I
Okay.
can't manage it, and if there's some kind of pressure or stress, I just can't take control of things. I just feel I can't take it, and I will just pass out anyway.
Sanai, are there any sort of, this feeling that I should die or, some suicidal ideations sometimes or
No,
no?
not really. No, no, I
Okay.
wouldn't.
Okay. Okay, that's good. So tell me about your past history. Have you had any problems, any issues like diabetes, blood pressure, heart problems, anything in the past or in the family?
No, my parents have blood pressure and diabetes, but I don't
Okay.
have any for now. Yeah.
Okay, that's great. So you're not on any regular medications.
No, no,
And hopefully you don't smoke or, any other
no. But yes,
addictions.
I forgot to tell my grandfather had depression. So I
Oh,
have some
okay. So,
history of yes.
so you know something about what do you know about depression?
Also, he was always sad. He didn't participate in any activities, and he had outbursts of aggression. So I have just seen him like that.
Oh,
Yeah.
okay. Okay. Right. So it must have been difficult then.
Yes, and he recently passed away. So it's like I have seen him very closely. He used to live with me. Yes.
When did he pass away?
I think 3 to 4 months back, roughly.
Okay. So by any chance, do you think that your episodes have increased since he passed away?
I don't know. I can't figure that out.
Okay. But you were close to him, you said, right?
Yes. Yeah.
Yes. Okay. So Sana, tell me about your marital status. Are you married? Do you have children or?
No, I'm not married. Now it's just me,
Okay.
my sister, and my parents.
Okay. And you're coping up well with your, status and with whatever is happening around. You have no issues with that.
No, nothing, no problems with that.
Okay. And you have, good family relations at home with your parents, with your siblings.
I can say, but my father is really disturbed after my grandfather passed away, so the family dynamics have been a little disturbed. But
Okay.
otherwise, it's just fine. I don't think it should affect me. I don't know. I don't have any idea about that.
Great. So, Sanala, you told me that you've been having these air hunger and this sort of shortness of breath attacks, and you feel very uncomfortable, and it has increased in the last few months. And your grandfather has passed away because you were very close to him, and you may think that it has triggered those events, right? And you don't feel good at work, unable to cope sometimes with your daily activities. That's what you told me.
Yes.
Is that
Yeah.
right?
Since three to
So, what do
four
you
weeks.
think?
Yeah.
So, Sana, what do you think that, what is happening to you? What's in your mind?
I don't know. I first I thought maybe I have depression like my grandfather, but I'm not crying every time like him, and neither am I aggressive like
Okay.
him. So I don't think it's that. I fail to understand then what's happening with me. Maybe there's some
Mm,
problem with my heart or my lungs. I don't know,
okay.
but
Right.
yeah.
And did you get yourself investigated?
No, no. This is the first time I'm consulting some
Okay.
doctor.
Right. So, Sana, you're probably right in a way about thinking that this is related to your grandfather's mental health issues, but it's not very much like him because this I agree with you that this is not depression. It is more like anxiety and panic attacks than it is depression. And I think that we can control it. The good thing is that
But
we can
why would
control
it
it.
happen to me? Why would it happen? I'm younger than my grandfather, or I don't know.
One is family history. The other thing is that a lot of people who are very sensitive, who are actually more intelligent, maybe I would say, they're also emotionally intelligent, right? And they take everything on the heart, and it just sometimes happens that you're not able to cope with it. It happens to all of us, but sometimes it is just prolonged, and you may need help. And it's a good thing that you've come to me for help, right? And I
So
will
you
be able
think I
to
will
help
end
you.
up like my grandfather,
No,
crying and depressed all the time?
we won't will let that happen, right? We're going to help you out and you will be better, because I don't see that it is very very bad in your case. It is very much controllable. I would refer you for cognitive behavioral therapy. You can read about it. I'm going to write it to you, and you can just read about it. You can go to the psychologist and take those sessions, and I think you're going to improve with time. How about that?
All right. Okay, I can try.
And we'll see, we're going to follow you up. If you don't improve, we can also start you on a medicine which is known as SSRI, and that could help you with your symptoms as well. But we're just
But
going to
won't these
keep it as
meditations affect my heart and everything? Because my grandfather also developed some heart problem because of the medication. Is
no,
it going to
I
affect
don't
me?
think so.
I'm
No, you don't worry
okay.
about that. It's not going to happen to you. You're a woman, and women are less prone to have heart problems than men. And these are not bad for the heart. But I'm not going to right now start you on these medicines. I'm going to refer you for psychotherapy, and then we're going to follow you up in 4 weeks' time, if that's okay.
All right. If you say so.
Sure. Sure. And then we're going to reconsider if we want to put you on these medicines or not, right?
All right. Okay.
Till that time, I'm just giving you propranolol, 10 milligrams of it. Whenever you feel like anxious or, restless, you can just take one tablet as needed.
Okay. But can I take this every day? Just profile. I
Yes,
mean, in case
yes,
I develop the attack. Okay.
yes. You can take it for 2 weeks at least, and then you can take it on an as needed basis once you start your
Okay.
therapy,
Okay.
right? Okay.